My name is Matt Minnick. I'm a PhD candidate in the School of Journalism and Mass Communication here at UW. I've been on SMAHRT as a project assistant for a little more than 2 years now, I think. And my most recent publication is in cyberpsych, and it's about the effects of listening to music and other smartphone uses on adolescent mood. There were a few things that came together that got me involved in this research. One was just the opportunity to work with Dr. Marino in this lab, which has just been really exciting. But I think I've always been drawn to adolescence for the reasons that a lot of people are. It's a time in my life that I'm still really interested in. It's a time of transformation for a lot of people. And understanding that period where we sort of become ourselves, I think is really important from a health context, and it's really interesting psychologically. I definitely think so. One is that even though smartphones have been around for a while, they're always changing. So every time you develop a new intervention or a new data collection method, you're sort of basing it on literature that was written for previous technology. You always sort of have to reinvent the wheel. I also think sometimes it's hard to come up with a research question in this area because we use smartphones so often that sometimes even researchers are unaware of what parts of our use are interesting or novel. Really clear, I didn't do the data collection for the mood paper. This was an ecological momentary assessment approach that was done before I came on the SMAHRT team. But what that is a tool that collects data in real time using text messages delivered to adolescents' smartphones. And that allows them to report what they're going through in the moment in sort of a real world context, which is really exciting. So I was able to just inherit that data set, which I'm very grateful for. I would say the thing that I developed in terms of tools is really just the application of the multi-level model that we used, which I'm also proud of. I think it fits well with this data set because it allows us to control for some of the individual differences while tracking how things change over time. I think speaking generally, it's that it's always a negative thing. I think that's an easy get, and it's something that people are pretty keen to say, and it resonates with a lot of parents' fears, I think, but the research just doesn't support it. So smartphone activity is ubiquitous and it's really nuanced, and sometimes it can really help adolescents deal with difficult problems or connect with others, but there are some instances where it can be negative. I think it's a misconception that screen time necessarily equates to emotional or mental dysfunction. So we have another mood paper, which is hopefully, I'll knock on wood here, hopefully in press. We should be hearing back about that in a couple of months. I'm defending my dissertation in about 24 hours. And then after that, I'm transitioning to a postdoctoral researcher role on this team for the B3 study, it's called, which is a longitudinal study of adolescent smartphone use that tracks how smartphone and social media use interacts with adolescent development over the years.